there's been obviously an awful lot on this very high profile area, but we also know that lots of other areas have been reset as well, which is why we're moving on to the next half of this session, which is around the transformation to remote working and support. And to kick it off, we've got Professor Paul Burstow joining us, who's a hugely experienced ex-social care minister and now president of the TSA and chair of the SCIE. Hopefully he's there.
Yes, I am, Tia. Thank you very much for the opportunity to present at this conference, and I've been listening into the earlier sessions. It's been fascinating to look at the questions that are coming up. So what I wanted to do was share some of the learning really that the TSA, the Technology Enabled Care Services Association, has developed really during the period of the pandemic so far, and say a little bit about what we think the post-pandemic landscape for technology enabled care will look like. So I don't think I've got control of the slides at the moment, so let me see if that will work.
There you go, you should have control now.
Okay. Yes, perfect. Thank you very much. So this slide just sort of says a little bit about the Technology Enabled Care Services Association, our vision and our mission. Our vision really is very much about people being able to choose technology enabled care as a means to enriching everyday life. We're a membership organisation across the whole of the United Kingdom. We have local government members. We have colleagues from across the housing association sector. We have response centres and manufacturers and others in our membership. And we're the only organisation in the tech sector that has been accredited by the UCAS as a quality assurance organisation, accrediting the services that are being provided across the country. Perhaps I could just start with a little bit of context. Tech has had a role to play for a long time, and a role to play across all ages for a long time. Technology enabled care is not just about the kit, although this slide tries to illustrate the sort of range of different types of interventions that technology can play in supporting people to maintain their independence. It is actually about the end-to-end service that the technology might enable or can enable to be delivered differently. And tech is also not just about those specialist high-end technologies, or indeed more targeted technologies that have been designed and delivered in the market, but actually how we use everyday technologies as well. This next slide just brings back to light some information that was the result of the whole system demonstrator project that was financed by the Department of Health and Social Care and published its results back in 2011. This is just some of the headlines. Very interesting, I think, to healthcare organisations, but I think more generally interesting in terms of the quality of life gains that were demonstrated from that study, looking at people living with long-term health conditions, not least the impact in terms of reduced mortality rates and reductions in A&E attendances back in 2011. And all of that was achieved without any major redesign of the services that underpinned the way in which the remote monitoring was being delivered. Last autumn, the TSA spent a lot of time engaging with colleagues across the housing sector, health and social care, really to enable us to develop and think about our agenda for the coming period, and particularly our call to action for tech. And we decided, as part of what we heard during that outreach exercise, very much that we needed to focus and orientate technology enabled care around the integration agenda and around population health. And this was the sort of strategy that we published back in the autumn of last year. Has three pillars: a focus on workforce, a focus on data, and a focus on partnerships. When it comes to workforce, what we had in mind was that this is both the direct roles within the technology enabled care sector, in terms of responder services and so on, but also the opportunity to develop new roles, more proactive calling and so on. And also the need to increase awareness amongst the wider health, housing and care workforces about the role that technology enabled care can play as not a substitute for, but as a supplement and an augmentation of the care services being provided. Data, well, this is the lifeblood really of integrated care systems. But whilst we may be data rich, we're very often intelligence poor. and yet this is going to be essential to the sort of proactive, preventative models of health, housing and care that is sort of envisaged in population health going forward. And then finally, partnerships. Smarter, more effective services and outcomes require collaboration. They require service integration and really the opportunities for sort of complementary ways of working between different services, which I've seen has been a bit of a thread in some of the chat and comments and questions already today, is very relevant there. I'm not going to speak to all of the themes, I'm just going to pick out a couple. One is the integration and interoperability being a key requirement really for integration to be a success, and migration to digital platforms also being a really essential part of this. I've talked about population health a little bit already. I just put this slide up to sort of illustrate what that means, what the ambition is in practice and the role that technology-enabled care can play right across the range of complexity of healthcare needs, from those that are mostly healthy to those living with long-term conditions or those living with complex needs. And really the aim here is to shift that demand curve, and technology can play its part in doing just that. And why does that matter? Well, it matters because partnerships through integrated care systems in England need to be more than just seen as partnerships between health and social care. They need to include housing as a key component and consideration, and clearly also the community and voluntary sector, not least because 50% of healthy life expectancy is not the product of healthcare delivery, it's the product of the social and economic environments in which we live. And really just to build on that slightly further, we in the tech sector very much see ourselves as in the context of a sort of occupational health way of thinking about services, about retaining, maintaining and recovery of function. And really the framing question that needs to be asked, particularly when making available technology-enabled care, but in many other ways, is what matters to you as an individual, not what is a matter with you. And at the moment, most technology-enabled care is still largely based on a 19th century technology, the analog telephone system. It mostly delivers standalone specialist devices that are installed by specialist organisations and connected to dedicated monitoring services. But by 2025, and it's already happening in some parts of the country, all analog telephone services in the UK will be switched off and replaced by digital connections. TSA has been working with our members to raise awareness of this, and indeed with government similarly. And we think as we come out of the pandemic, this has to return as a core focus of attention, because there's great opportunity, but also great risk associated with it. But then, of course, COVID-19 happened, the best laid plans, you might say. And this has meant that the TSA has had to pivot to face the pandemic and really seek to try and mitigate some of the impacts on the sector and those who rely on our services. And we've been very grateful to the Department of Health and Social Care for funding and sponsoring some work that we've been doing over the last few months, which is where I want to turn now. This slide just makes the point about the pandemic having really triggered a cascade of compounding risks. A lot of the focus understandably has been in the sort of suppression and management of the condition in our healthcare system, but there's a whole set of other impacts that need to be borne in mind. At the same time, we've seen this having an acceleration impact as well as an amplifying impact on pre-existing trends, whether they're positive ones or negative ones. And certainly in the healthcare system, what we've seen, the ambition of the long-term plan was to adopt more virtual delivery of healthcare over the next 5 or 6 years. We've seen in the space of a matter of weeks, the NHS reconfigure itself and move hugely to remote working, delivery of outpatient services, delivery of GP services, and the like. I just though would like to draw attention to that fourth wave, the psychological and the social impacts that are accumulating and will have ever greater cause for concern, and many of the services I suspect we're involved in. And I just share this slide, which comes from a very recent report by the World Health Organization, which just tries to capture some of those impacts. And I'm not going to rehearse them all, but I think increasingly we need to be thinking about the way in which we join up public policy to have health in all policies when it comes to responding to some of those psychological and social impacts. So what has the TSA been doing as its response to COVID? Well, first and foremost, our approach and our bottom line has been to keep people safe. There are currently 1.7 million people, maybe nearly 2 million people who are connected to response services, to alarm centres around the country. And our core concern has been making sure that those services didn't fall over, particularly during the early stages of the lockdown, as staff were uncertain as to whether they could be in call centres and how they needed to move to remote working from home. And the work that we've been doing for the Department of Health and Social Care over the last 3 months has been in 3 phases. And we've been providing guidance, advice, practical support and aid to hard-pressed alarm response centres to carry on and enable them to move to remote working. And our key priority has been to make sure that that lifeline has not been disrupted. But we're currently working in our 3rd phase around ensuring continuity and making sure that what we've picked up during the work is translated and spread more widely. So as a result of the work over the last 3 months, we, I think, have a much clearer idea of what the strengths and weaknesses of the tech sector are. And we'll be sharing in a report, white paper, a TSA white paper in July, all of the findings. But I just wanted to highlight a couple of findings from the work we've been doing, which has involved 92% of all UK tech services have been contacted and supported in one way or another. For example, a number of providers are now providing much more support to enable hospital discharge with volunteer services. Some services have moved to more agile, easy to deploy, low contact technologies like mobiles, apps, guided self-installs so that people can connect themselves to the monitoring. And all of this has been trying to focus on how we slow the progression of need, how we better manage and support. And I want to give 3 examples of what that has meant in practice over the last 3 months. This is Dawn. Dawn lives in Carmarthenshire in Wales, and she has mental health problems, and she's been provided as part of the shielded population with a service by Delta Careline. And they've been providing outreach calls to her and some very practical things like enabling her through a video portal to stay in touch with her family. She's seen this as an absolutely critical lifeline. And the Delta Care services have been absolutely focused not just on maintaining the existing support they were providing to those already connected to their services, but how they were able to provide rapidly support for this shielded population. And they've been working with the community and voluntary services sector to maximise the sort of prevention opportunities and also making sure that tech is playing its part in all of that. Another example comes from Hampshire, where the Agenti partnership that has been commissioned by the county council there was used to deploy additional support to the 53,000 people that have been shielded within the county. And one of the things they set up were additional call centres to try and keep in touch with people, but they found that capacity was still strained at times. So PA Consulting and AWS, who are the 2 providers of key providers in Agenti services, have developed very rapidly an AI-driven chatbot called Wellbeing Automated Calling. And at its peak, that was delivering 2,500 calls to the shielded population, asking people how they were feeling and if they needed any support. It allowed a triage to be done to make sure that those that were in most need of personal human contact got it, and resources were deployed accordingly. And talking about deploying resources accordingly, my final example comes from Merseyside and Mersey Care. This is Sue. Sue is a nurse. Sue was in the shielded population, so was having to be based at home, but she wanted to carry on her nursing role. And Mersey Care Telehealth, they have a monitoring service. They recruited a significant number of shielding nurses to provide their telecare service. They doubled their workforce as a consequence of their recruitment into that population, and were able as a consequence to give purpose to nurses who would otherwise not been able to practice, but also continue to provide this sort of support in terms of making, for example, 74% of people feeling more confident that they were able to manage their condition during this period. 2 last slides. From all the work that we've done over the last couple of months, I think we've identified 3 things that we think need to come next. 1, we need to make sure that the proactive interventions that tech can support are actually widely available. 2, we need to de-risk this winter by making sure those proactive approaches are embedded. And 3, we need to make sure that the quality assurance catches up. And that's just to conclude 3 things to remember. Technology, it's part of everyday life. It's the person, not the technology. It's about enabling life. And thank you very much for the opportunity to present today.